another wonderful time on your number one health program, reaching you from the station of excellence. You know how much I love to do this with you. Every week, I love to see your face. And of course, first on our lineup is on Dr. Love series. Dr. Love, what do you have for us this week? I know you'll be talking about coping with the hot weather. You've said a whole lot. I don't know what the package looks like, but we need to see this together. And then we have a recap on the episode that featured Nurse Ota Okaha, a nurse of the Federal Medical Center, Ibutemeta. She talked about how to manage diabetes. Diabetes it has affected millions of people around the world, men and women, and even young children. But you know what I always preach on the show? Prevention is better and cheaper than cure. So it's important we take a look at that recap of the episode on diabetes. My name is Nkem Okibi, and I'm your regular host on the show. We'll go on a short break. When we return, we'll join Dr. Love series on the topic coping with the hot weather. We'll be right back. Stay with us.
You're welcome to Dr. Love series. My name is Dr. Yusuf Ademola Harun, and today I want to talk about a very sensitive topic, which is coping with hot weather in our society, in Nigeria in general and Lagos State in particular. In the northern part of Nigeria, from Abuja upwards, the weather has been very hot. I have a sister who just came visiting Lagos, and she said, wow, you guys, your weather is better. In the north, it is very harsh, and it's due to geographical locations and climate conditions. But in the south here, Lagos State in particular, you can notice that even today rain fell, and today is December 20, when we should be in severe harmattan, where it should be very, very hot. So the weather has been erratic, and it has not been consistent with how it should be or how it has been forecasted. Now, what are the health challenges in a weather like this? One of the features or one of the things we notice is that people in this particular condition, they develop what we call viral infections or viral exposure due to the weather. One of it is tonsillitis. You see some children developing inflammation of the tonsil. That is called tonsillitis. A common thing they all have again is common cold, catarrh, cough, sneezing. They may even develop fever. Some of these are due to viral infections. Some are as a result of bacterial infections, and some of them could just be allergy or allergic reactions. The question comes to mind, some people develop measles during this time. So is it that the measles vaccine is not able to treat, is not able to prevent them from this condition? Absolutely no. The thing is that there are some things we call primary failure, secondary failure, and even tertiary failure of these vaccines. So we have to know what is really causing it and how we can prevent it. Another thing is that this weather we are having now, which is hot, especially between 11 a.m. to 12 p.m. in some parts of Lagos State, is also due to the depletion of the ozone layer and our environmental conditions. You can notice that many of the cases, there are generators, fumes, you have chemicals exposure, we have sewage disposal which is not properly done. All these kinds of air pollution and also environmental pollution can affect our climatic conditions and weather in this particular region. So that is why we are having a depletion in the ozone layer due to the exposure and emission of gases from companies. You know, Lagos is an heavily industrialized state with lots of companies dishing out or emitting lots of fumes. Cars also, many cars are on the street emitting carbon monoxide or carbon dioxide, nitrogen oxide, sulfur, and many companies are bringing out different things, chemicals that are affecting us. That is why the weather is changing and we are developing certain medical conditions. How do we prevent this, or how do we stop this? Number one is that let us stay hydrated. Drink adequate water. Coconut water is very good. Don't emulate or don't believe in the myth that says that if you drink coconut water you are going to be dull. That is not true. That's just a fallacy. You can drink coconut water. Also, try to make sure that you are preventing yourself from inhaling smoke, fumes, dust, and all these things that could cause allergy. And finally, also try to see a doctor if you're having any of these medical conditions that could be severe. I'm Dr. Love, and we love you. Thank you very much.
Thank you so much, Dr. Love. And you know how it is on the show. Make sure that you get all the information required at the certain time. And this period, you agree with me that it has been very hot since December. Dr. Love, thank you for dishing out those tips on how to stay healthy this period. Moving on, next is a recap on the episode that featured Nurse Ota Okaha on the topic diabetes. Let's see this together. We'll be right back.
Diabetes is a chronic metabolic disorder characterized by elevated blood sugar. Simply put, there is increased level of blood sugar in the blood. There is excess blood, there is excess sugar in the blood. That is diabetes mellitus. There is another type of diabetes, that is diabetes insipidus. We are talking of diabetic mellitus. The cause is unknown. Cannot say pinpoint like this is the cause, but there are some predisposing factors. There are some predisposing factors like the genes play a vital role, family history, the environmental and the lifestyle play major role in diabetes mellitus. There are major three P's that we use to diagnose diabetes mellitus. The first one is polyuria. Polyuria means frequent urination. Then there is polydipsia. Polydipsia, there is increased thirst. Then another one is polyphagia, increased hunger. This is the major three P's that we use to diagnose diabetes mellitus. And there is weight loss. You see the patient, somebody that was fat, reducing, weight loss, headache, fatigue. There must be blood vision. Then we will say, these signs, these are signs of diabetes mellitus. In children, the cause is unknown, but there are predisposing factors, especially when there is family history. Either the parent or grandparent has a history of diabetes. There must be a family history for a child to have diabetes mellitus. There is a family history. It cannot just happen like that. Either the grandparents or the parents has diabetes. There are two major types of diabetes mellitus, but we still have gestational diabetes. The first one is type 1, previously known as insulin-dependent diabetes. Insulin-dependent diabetes. This one, the pancreas is unable to secrete enough insulin. That is type 1. And it's known as juvenile diabetes. That's the ones that occur in children, most common in children. Then the other type is type 2. Type 2, the pancreas secretes insulin, but the cells in the body, they are unable to utilize this insulin properly. Then as the disease progresses, there will be lack of insulin in the body, and it occurs in adults. And that one is not insulin dependent. It's non-insulin dependent diabetes. Then that one, you can treat it with oral drugs and diet. How often depends on the health status of the individual. If you see yourself adding weight, that is why regular checkup is very important. You go and check. Then every morning, for those that already have diabetes, at least it's a daily thing. But for normal person that does not have, there's no family history, the weight is maintained at least once in a year, it's okay to check your sugar level. Then the range, there are two types of tests: random blood sugar and fasting blood sugar. In random blood sugar, the normal range is between 80 to 130 milligrams per DL. That is random blood sugar. But in fasting blood sugar, the normal range is between 70 to 99 milligrams per DL. That's the range for fasting. Then the range for random is 80 to 130 milligrams per DL. The complications of diabetes can lead to kidney failure, because most of the patients that have kidney problem, check well, they are diabetic. That's the complication of diabetes. It can lead to retinopathy, diabetic retinopathy, that can lead to blindness. Even the nerves, their wound doesn't heal fast, which can lead to amputation of the leg. So it's better to prevent it. Prevention is better, especially when you know that you have family history. There is family history, you better prevent it because it's deadly. It's a silent killer. That one is called gestational diabetes. This person, there's no history of diabetes before, but during pregnancy, during all this routine antenatal checkup, you see the person having increased sugar level. We call it gestational diabetes. That one, after childbirth, can go. It can go because it's just from nowhere. That one can go. There's no problem with that one. Then the prevention, very important. We start with healthy diet. We call it healthy diet. It's very important because most of the diseases, all this chronic, is from what we eat. So we have to eat healthy diets. And what are these healthy diets? The diet that contains the food nutrients that we need, the carbohydrate, protein, minerals, then there are vegetable vitamins. That is what we need to eat. Let's forget about processed food. It's not good for our health. And these sugary beverages everywhere, they are even increasing the quantity. It's not good. Our water that God gave us, we drink it. It's very good for us. That is healthy diet. And secondly, then exercise. Very important. Every week, be active. Be active. In this generation that you sit down in the office from morning till night, no. Make sure you are active to prevent diabetes mellitus. Then another thing, regular medical checkup. Go and check. It's better, early detection is very important so that you start treatment as early as possible. It will not lead to the complication, because when you know it, diagnose it early, then complication will not happen, because you know what to eat, what to do, everything about it. You will live long. It's not a death sentence. It's all about discipline, determination. When you determine that this is what I want to eat, this is around, you make up your mind, discipline yourself.